Hello, I am Dr. Elliot Davis. This dental tutorial provides insight into a recently developed, sophisticated, yet conservative, alternative treatment to the traditional gum grafting surgery and porcelain veneers therapy. It is titled, An Alternative to Periodontal Grafting Surgery and Porcelain Veneers, a non-invasive, non-surgical approach utilizing advanced Invisalign orthodontic and teeth whitening concepts. To keep things as copacetic and comfortable as possible, please read the appropriate disclaimer prior to viewing this tutorial. This dental tutorial is intended to be informational in nature. It contains some highly graphical photography that some might deem offensive. Please use prudent discretion and accept my apology if you are bothered by a portion of the content. I would like you to appreciate how I, along with the patient, arrive at the most appropriate dental treatment. Let's look at this young woman who has some serious dental concerns and follow her experience. On the right, you will see the patient's perspective, what she sees. On the left, you'll see what the dental professional sees. She's had extensive dental care with her orthodontist and periodontist. She's had a palate expander, headgear, brackets, wires, and elastics, and retainers for more than 8 years of orthodontic therapy. At age 23, she had a free gingival graft procedure in the lower front portion of her mouth. She is not under the care of a general dentist. A periodontist is her triaging dentist. Her main concerns are the roots of her teeth are sensitive to cold, and she is not sure if the pain in the jaw joints is due to her teeth or possibly some temporomandibular joint dysfunction. The main culprit for her sensitivity was likely tooth number 12, her upper left first premolar. There was a large amount of gum recession. There was irritated gingiva. Was the tooth causing problems that was radiating to the jaw? Was there some independent jaw problem? Or were both issues that needed to be addressed? In 2008, her periodontist recommended 4 additional gum grafting surgeries. Her orthodontist had recommended retreatment with brackets, wires, and elastic. She was told she was not a candidate for Invisalign. The periodontist had recommended her to the orthodontist because he was concerned that tooth, number 12, which had the bone loss and the exposed root, might need to be lost, and he wanted the orthodontist to look into the extraction of 4 first premolars. At the end of treatment, he said he would likely recommend 4 to 12 porcelain veneers. Why did she seek a second opinion? She was not sure that she wanted to have 4 more gum grafting surgeries. She was not confident that this orthodontic therapy would yield better results than it did the first time. She was not comfortable with the thought that her teeth would need to be shaved down so she could have porcelain veneers. She did not like the fact that the removal of teeth were now being considered, and the cost estimates for all of these treatments were quite significant. My recommendation was for Invisalign removable orthodontic therapy, at-home custom teeth whitening to help alleviate sensitivity, some enamel remineralization to harden the remaining tooth structure, and some desensitization to minimize the likelihood that the whitening would cause sensitivity. This was the digital panoramic x-ray of her mouth. She never had a cavity, so there are no existing fillings to view. There are no signs of tooth decay. There are no signs of infection. There are signs of bone loss, so we know the pain and discomfort she is experiencing are either coming from the exposed roots of the teeth, her bite, or the jaw joints. Due to the sequencing of her therapy, she did not notice much of a difference in her smile for the first couple of months. However, by the end of her 7th month, the idealization of her arch form and the repositioning of her teeth led to a dramatic improvement. Her smile is now gorgeous. While her smile looks wonderful, maybe more important, her mouth has been pain-free for more than 6 months. The gingiva or gum tissue by the neck of her upper left premolar is now less red. The gums are less puffy, and healthier than they were before. After 6 months of full-time retainer therapy, while the teeth are being held in place, notice how nicely the gums are continuing to tighten up and get healthier. In between the two center teeth, as well as note the bite getting ready to settle into place. Once we have 6 months of nighttime retainer wear, you'll notice that the space between the canine teeth in the top and bottom is no longer present. That's because the teeth have settled beautifully into place. There was no need to shave down any teeth. There was no need to do any additional therapy. Just be patient and let an excellent design run its course. While it took approximately 1 year for everything to settle into place, that wasn't the only thing that improved throughout her entire mouth. The gums and the teeth positioning also improved. From the start to the completion of 6 months of nighttime retainer wear, notice how everything is so much healthier. What might please her even more, the same periodontist who had informed her that she would likely need these 4 gum grafting surgeries has now told her that she would not need any additional gum grafting surgeries. She tries to give robust ear-to-ear smiles. She thinks that she smiles as wide as Julia Roberts. However, her smile is much more modest and more closely resembles Eli Manning's smile. Let's review her projected simulation and see how close we came. Let me review what we're looking at in this compilation photo. The top left, we're looking at the initiation of therapy. The top right, we're looking at after she's done with active therapy, where the teeth are intended to move after approximately 7 months. On the bottom right, we're looking at where she's presenting after 6 months of full-time retainer wear, keeping all the teeth as they should be, allowing final settling to occur. The lower left, that's after 19 months from where we started on top. Notice how final settling has occurred. She's worn the retainers part-time in the evening for 6 months, and since she is a competitive athlete, when she is working out and participating in competitions, she would wear her retainers during those times as well. So how long did the treatment take? Would you say it took 7 months because that's how long the active therapy took? Would you say it took 13 months because that's how long she was wearing a device full-time? Or would you say it took 19 months because that's when she started to have full settling of her teeth and she had been 6 months into her evening therapy? I will let you decide. These arrows nicely summarize how much healthier her mouth is now compared to when we started. It would not have been possible to obtain these natural and healthy results if the treatment had incorporated the extraction of teeth, periodontal grafting surgery, traditional orthodontic treatment with brackets and wires, and porcelain veneers. So let's review. We have a lovely, energetic, and healthy young woman with multiple dental pains. We wound up with someone who no longer has to drink cold beverages through a straw, who no longer has that TMJ pain and their headaches, who did not have any teeth shaved down or had to have any teeth removed. The same periodontist who performed her gum grafting surgery has examined her and updated her status. She no longer needs any of the 4 additional surgeries. Her teeth accumulate less stain, less plaque, and less calculus. The top tooth that was kicked out and pressed against her lip and the one that was kicked in now both fit beautifully. Her smile is symmetric and balanced. All of her teeth are now in full function. The teeth that weren't touching, they are all touching. Her bite and arch forms are much improved and very close to the ideal. Her teeth are whiter and her smile is vibrant and now is age appropriate. Maybe best of all, the cost of the treatment was a fraction of what was proposed by her periodontist and her orthodontist. I am Dr. Elliot Davis, the Manhattan dentist. Thank you for your interest and for watching.